The truth about ESG, does it really work? The ESG is a procedure where there are no incisions and an endoscopist goes through a patient's mouth and tries to suture up the stomach to copy what we're doing surgically for a sleeve gastrectomy laparoscopically. The concept behind the ESG is they're trying to recreate what we're doing surgically with the gold standard operation, which is the sleeve gastrectomy. With an ESG, they put multiple sutures along the entire wall of the stomach, and then with this, it recreates a restriction on how much a patient can eat. Unfortunately, with the ESG, there aren't the same anatomic or physiologic changes that we see with the laparoscopic sleeve gastrectomy or the sleeve. With the sleeve gastrectomy, we're actually removing approximately 60 or 70% of your stomach. So by removing that portion of the stomach, not only do you get restriction, but you're also getting the physiologic or hormonal benefits that come with removing part of your stomach. And those are hormone changes such as a drop in ghrelin. And with that, your appetite will decrease. And this kind of a change we don't generally see with something like the endoscopic procedures because you're not actually removing part of the stomach, and so you don't get the benefit of the hormonal changes. There's also technical issues when you're trying to recreate what we do surgically with a sleeve gastrectomy when you try to do it endoscopically. Oftentimes the pouch is not anywhere near the same size as what we would do with the standard sleeve. Also, the sutures that they put in with the endoscopic sleeve more likely than not fail over time, and that can be as soon as 1 year where the stomach completely re-expands. I frequently see patients in my office who want to have the standard operation of a sleeve gastrectomy who have tried the endoscopic sleeve and failed. An example is the one just earlier today that I did see for the same issue. And typically when I take these patients back to surgery for the correct operation, we find that the sutures have all the way pulled through and the stomach is almost back to its normal appearance. It's generally accepted if you have the ESG that more than likely you're going to require a revisional or another procedure moving forward. So what are some of the drawbacks of the ESG? Number one, it is more than likely going to be a temporary fix for weight loss. And my general goal for all patients is a permanent fix for weight loss. So anything that's temporary, in my book, is not acceptable. I don't believe in diets, I believe in lifestyle modifications, and I don't believe in any other methods that are only going to temporarily allow weight loss. This has got to be a permanent solution for lifetime durability. Another issue with the ESG is whether it's effective or not. Right now, our studies are showing that the ESG is about as effective as some of the newer medications, the GLP-1 agonists that have come out, and the standard expected weight loss or total weight loss at a year is somewhere around 10 or 15%, maybe a little higher. And generally with surgery, we see total weight loss at a year somewhere around 30% or more. You're going through a procedure and you're getting about half the weight loss, but you're still going through, it's still a major procedure that needs to be done. It's also highly dependent on surgeon technique and whether a surgeon or another type of doctor is doing it and their training level. There's been a lot of serious complications from this type of procedure, particularly in the area where I'm at. And so there is generally a high level of concern when we see this procedure is going to be done. These kinds of things can be ruptures of your esophagus, ruptures of the stomach, or stitching other areas outside the stomach that can cause serious organ damage. That leads to complication rate. Complication rate with a sleeve gastrectomy, the gold standard, runs very low. Serious complication rate is well less than 1%. Something like a leak would be the most serious complication. And for my own personal population, that's 0.01%. When you compare that to, say, for an ESG, complications rates run up to 2%, which is still a low number, but overall much higher than the gold standard operation of the sleeve gastrectomy. Does this ESG have a role in treating obesity? That really depends on the level of obesity or a patient's BMI. If it's going to be included in a treatment plan for a patient, it really is specific patient populations that should be used. It has no role in treating obesity in patients with a high BMI, such as over 35 up to 40, or meaning if a patient has class 2 or 3 obesity, it's really not the correct operation for a patient. If you want to go from an ESG to the gold standard of a sleeve gastrectomy, The problem is it's a much more complex procedure at that point. So you take a very safe surgery, the gold standard of a sleeve gastrectomy, and now you're turning that into a more dangerous operation because you have to potentially remove all of the stitching that's there or potentially staple through some of that, which increases the leak rate, which is one of the worst things we worry about after a standard sleeve gastrectomy. So you've taken a patient who could have started with a great operation and given them an operation that maybe not as good, and then now you have to make it a more dangerous situation to move on to the correct operation. For more information about bariatric surgery, click the link below.